So this is going to be a cranial dorsal hip luxation, guest starring Dr. Manukian. And so we are going to talk about how to put it back in. So remember, what's usually happening is after hit by cars like this dog, you get cranial dorsal hip luxation. So what happens is the head of the femur gets stuck kind of on the pelvis. So the first thing you usually want to do is you want to disengage that by externally rotating. Then you can have a towel underneath the dog to put counter traction. I often will actually try to push with my thumb, the greater trochanter, kind of push it down. So externally rotate, I'll kind of try to push it down like that with someone having counter traction with the towel. Then you'll internally rotate and extend to feel it pop in. So my hands are going to be here, we'll get a towel here. I'll externally rotate and I'll push it down from here with my thumb, then internally rotate and extend, okay? So, oh, we got this sling, use this. All right. So, Manukian, if you want to come where I am, I think that's the easiest. Yes, you can feel the greater trochanter right here.
Yep. So I externally rotate.
Yeah, because you want to disengage, then you want to kind of push it that way.
Down.
And then internally rotate and extend. You usually kind of feel it plunking. Feel it plunking?
Oh, no. Okay, so externally rotate.
Yeah.
Push and then extend and internally rotate.
Yeah.
I can feel it going in, but it doesn't feel securely going in.
Do you mind if I feel it? Because
Yes.
sometimes if dogs are really loose, they'll pop in and out, and then there's a poor prognosis. So if it is truly, because you feel like you might be
Sleep.
Oh, nope. Okay, so I actually think you went ventral there.
Okay.
So right here what's happening is that you're actually successfully going with that, but he's coming down here.
So then maybe
You
more
need to get him back.
cranial.
Well, so you're getting him down.
Oh, okay.
It's more, you gotta, I'm gonna be extending his hips, so you just gotta extend it all the way
Okay.
back, you might be able to
Okay.
pop in. It's in the right general area. I think that's in. So let's take a radiograph. Okay, so we got it in. We got it on the last video. It wasn't a super distinct clump, which is actually, he's really loose, so I'm a little bit more worried this dog will pop back out, given how loose it feels. But you can feel the ischiatic tuberi, the point of the wing, the ilium, and the greater trochanter, so they're making a triangle. Now after you get it in, you want to put downward pressure on the greater trochanter and put him through range of motion for about 15 minutes.
Yep.
And the reason here is you're trying to rub out any fracture or any hematoma or anything that might be in the joint. Trying to rub out any joint capsule that kind of might be in there too. Try to make the odds of them staying in higher.
Yep.
All right, so there we go. So I would do that for about 15 minutes and we'll get the other shot.
Okay.
And then we